The sweet relief of a headache gone, courtesy a reliable dose of acetaminophen, otherwise known as paracetamol. Be aware, friends, for this savior can also become a killer if you acutely overdose it. So let's all raise our hands and give a shout out to a responsible medication habits. If you are interested in learning more, as I am, then subscribe and let's dive into it. So we both agree that acetaminophen is a widely utilized medication that effectively alleviates mild to moderate pain and reduces fever, making it a common ingredient in many over-the-counter formulations. With its high bioavailability, it is quickly absorbed into the bloodstream, reaching peak concentrations within 90 minutes of ingestion, providing a swift relief from discomfort such as fever and pain. So acetaminophen dose of greater than 7 grams will cause toxicity. Even if it is greater than 12 grams, this will amount to a fatal toxicity. It is generally not recommended to take more than 4 grams in a day. When acetaminophen is taken, it is primarily metabolized in the liver through glucuronidation right here, as well as sulfation. These are very important pathways. And what is the essence? So acetaminophen, which can be toxic, has to be converted into inactive metabolite. So through glucuronidation, it forms acetaminophen glucuronide. This is an inactive metabolite, and on the other side, it forms acetaminophen sulfate. So these substances may be less toxic for the body, and it is good. But a small portion is converted into this highly reactive substance we call NAPQI. This is done through the cytochrome enzyme system. So the full name is N-acetyl P-benzoquinol imine right there. This substance right here is responsible for the hepatotoxicity that occurs with acute paracetamol poisoning. And so the body wants to get rid of this substance or detoxify it in a way. And this is where we need this critical antioxidant known as glutathione right there. This is critical antioxidant which helps combines to this toxic substance and then convert this into cysteine as well as mercapturate, and these conjugates are then excreted into the urine. So this is a normal pathway that the body uses to get rid of acetaminophen. But let's take this scenario where somebody has an acute overdose of paracetamol or acetaminophen. Now, once you overdose, the pathways through glucuronidation to that side and through sulfation now becomes very saturated because there is a lot of paracetamol in the body. So majority of the acetaminophen is now going into the formation of NAPQI right here, which is the toxic substance that we've already mentioned, right? It is very toxic. And so what happens to glutathione is that glutathione is going to try to detoxify it, and it is going to lose a lot of the cysteine groups right there. And so to a certain point, glutathione is going to be depleted. Okay, its level is going to go down. That is right here. And once that occurs, the substance, which is NAPQI, starts to bind to proteins in the hepatocytes. And it does so also in the mitochondrial proteins. And this leads to a decreased energy production as well as impairment in ion channels. And this eventually leads to hepatotoxicity as well as cell death. And this is the basis why we use N-acetylcysteine as an antidote, because this substance kind of donates cysteine group to the what? To the glutathione so that it can restore the detoxification process. So this is a very important scheme to understand, as it will help you understand how paracetamol is metabolized in the liver. Now, this is going to be an important add-on. So there are a certain group of people, like people who are alcoholics, okay, people who have cancer, people who are having malnutrition, or infections such as HIV. In fact, these people may have a low level of glutathione, meaning that lesser doses of acetaminophen may actually cause toxicity in these contingents. So in your clinical practice, you have to be careful when you are giving this group acetaminophen. Now, an acute overdose of acetaminophen occurs when a toxic amount is ingested within an 8-hour window, leading to a clinical presentation that unfolds in distinct stages. So, the first stage, which typically occurs within 24 hours, is marked by GI tract irritation, resulting in symptoms such as nausea, vomiting, and anorexia. The second stage you see right here, which also develops within 24 to 72 hours, is characterized by abdominal pain. It may also be absent, and a deranged liver function test. The third stage occurs between 72 to 96 hours, and this is a critical phase where liver failure occurs. There may be encephalopathy, severe metabolic impairment, and a peak deranged liver function test. And the final stage, patients either recover or progress to multiple organ failure. All right, so now we're going to take a look at this simple algorithm and how to proceed when you have a patient present with acute overdose of acetaminophen. The question you ask is, when was acetaminophen taken? This is a straightforward question that demands a reliable answer. If the answer is 4 or more hours ago, but then not beyond 8 hours ago, then you proceed to take blood samples for acetaminophen serum assay immediately. Once the result comes and then you realize that acetaminophen level is above the treatment line on the Rumock-Matthew normogram, then you would administer acetylcysteine immediately. If the patient is still not within the 4-hour point, then you're going to wait until they are within the 4-hour point before taking acetaminophen serum assay. If they come and it is beyond 8 hours based on clinical decision making, acetylcysteine can be administered immediately even without taking the blood samples for acetaminophen serum assay. Again, there are instances where a patient arrives and you don't get the answer to when acetaminophen was taken because patient is not alert or people were not around. And in such cases, acetylcysteine can also be administered immediately based on clinical decision. All right, so this is the Rumock-Matthew normogram, which is a valuable tool used to interpret plasma acetaminophen levels. In simple words, this white line is going to be the treatment line, okay? If the patient's blood sample acetaminophen levels falls below the treatment line, then you would not administer N-acetylcysteine. If they fall above the treatment line anywhere here, then you have to initiate acetylcysteine. So you need to plot the levels against time from say 4 hours to 24 hours. If the initial acetaminophen levels plots above the treatment line, which starts, of course, as you can see, 150 microgram per milliliter, at what time? At 4 hours, right there. Then you must administer N-acetylcysteine. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.